I may be a little nervous. This is my first time speaking to so many empty leather chairs. As I look through this list, I'm probably the only person that's not recognizable with the organization I'm from, and so I thought maybe I'd start with explaining exactly who I am and how I got to be here. I own a store called SMASH. I'm 26, and SMASH is a clothing store and screen printing shop located in beautiful downtown Des Moines. So essentially, I'm the token Main Street guy, the Mike Six-Pack, if you will. I grew up in a small town in Iowa, studied history at the University of Pennsylvania, then moved to the United Kingdom where I married a girl from London, who was more than surprised when I decided to move back to Iowa and start a screen printing and retail store. Not just for the fact that she had to move from London to Des Moines, but for the fact that I had no experience in retail, design, or screen printing, and the closest I had come at Penn to a formal business education was a macro econ class, which I dropped after getting 42% on the supply and demand test. I started the company at the bottom, printing shirts and selling them out of a bag on the street or on college campuses. And while I was selling shirts on the street in Union Square with other vendors, I thought to myself, well, it's true. You really can't do anything with a history degree. But I worked constantly and set up a website in 2004 and then opened SMASH in 2005 as an 1,100 square foot retail store by myself and grossed $90,000 the first year. Now, 4 years later, the store has 4,200 square feet, 12 employees, and will gross over $1 million this year, having been featured in the New York Times twice, NPR twice, and several other national publications. Along the way, I've gotten the business education I needed. I've had to figure out business strategy, management, bookkeeping, but healthcare has proved probably the most frustrating. In 2007, after 2 years of being uninsured, I bought an individual policy and felt like I was one of the chosen few. And my insurance epiphany probably came when I had a minor surgery and weeks later was sent a bill for $347 for miscellaneous hospital charges. I started to wonder what would happen if I started sending out customers $347 miscellaneous t-shirt charge bills after I got done. But that's kind of the introduction of the system doesn't work on a market and it didn't make sense. And you guys probably know most of the problems as well as I do, but the solution is a lot trickier. I think the bill that everyone has come up with here is a pretty good start. I think the exchange addresses a lot of those problems with general regulation, better pricing, transparency, and coverage rules. But in my opinion, competition is always more effective than just regulation, and the public option is the only option strong enough to compete with the private sector. Now, when I hear public option, I don't hear free option. I am not here asking for free healthcare or a government handout. I am asking for rational healthcare. As a business owner, I would gladly pay 8% of my payroll into a public option, since that would give me two things. One, peace of mind that my employees would be covered by something backed by the government, and two, more importantly, an ability to accurately budget per year my company's healthcare expenses. Right now, my premiums and bills will fluctuate between 6% and 22% of payroll on any given year. An expense that large and unpredictable is what drives companies out of business, not a tax that they know they have to pay at the beginning of the year. Now, it may sound strange that I would be willing to pay a new tax, but rest assured, I am not a socialist. I am not here trying to undermine capitalism. Rather, the small mountain of money I send to you guys several times a year does not make me clamor for more government. But the unsustainable cost of my current health care, the one thing that could probably ruin the company, makes me clamor for an actual option. The public option is less intrusive to me, since I would have the option. I could take the public plan or I could take the private plan. With simply doing the exchange or with simply regulating the markets, it seems like bigger government. You could have new rules, possibly required health care, some subsidized by the government, meaning that my tax money would go to subsidize some people's money going to the private insurance industry. On the other hand, my private money has to go to that same private insurance industry. Now, even somebody who has dropped out of macroeconomics says that that's kind of a frustrating thing to deal with. I understand that the issues are complex. Insurance blends technical problems with ideological differences, and many of the details of the plan really can only emerge when it is functioning, making these details possibly to know now, such as how many people will take the public plan, how many people, if rates will actually go down. But not knowing every detail of the future shouldn't stop us in the present from working for a better one. And something needs to be done for the future of small business healthcare. We shouldn't lose sight of the fact that this is one of the few countries where somebody like me can start a business with no business knowledge and succeed. And while you guys can't legislate entrepreneurial spirit, you can help to take down some of the hurdles impeding entrepreneurs from starting companies. Right now, healthcare is one of the biggest hurdles to either entrepreneurs trying to start companies or existing companies staying in business. And I think the public option is our best option for taking care of that. Thank you.